The city is expanding its efforts to make homes in Boston smoke-free. To tell us about the campaign, our guests from the Community Initiatives Bureau of the Boston Public Health Commission, Eugene Barros, and the Superintendent-in-Chief with Boston Emergency Medical Services, Brendan Kearney. Thank you all very much for being with us.
Thanks for having us.
I want to start with Eugene. This is still not a compulsory thing, but I guess there are some really urgent reasons why you want people to get that smoke out of the house.
Yeah, so sure. First and foremost, obviously, we're concerned about the health impact. We know the only way to eliminate smoke, secondhand smoke in a home, is actually not smoke in the home. So that's why we promote it. But the second, it's one of the leading cause of fires, deadly fires in the U.S. So, on average, 560 people died yearly because of smoking-related fires, and we know, and it's totally preventable. So
we've had at least 4 fires, serious fires in Boston that involve smoking materials since the beginning of June, I think.
Correct. Yeah, and I read on a paper that it cost over $10 million, obviously, and we know also the building cost, the damage, but also, we know the impact that it has also on people's lives. That everything is destroyed, they lose their memories. I mean, I know people that went to fire, and obviously, but it's not a good thing. But especially when people lose their lives, it's even worse. And we know that both the inside and outside is a problem. Even sometimes people in our work at the Boston Public Health Commission, when we talk about smoke-free housing, we want people to, even outside, to send some boundaries where they smoke, away from buildings, because the vegetation sometimes, if they throw cigarette butts in, it can catch fire. So.
Superintendent, you've seen this problem sometimes in a very urgent fashion as well, when there was smoke in the house and people had to be a lot more careful.
Oh, sure. Well, we respond, as Eugene said, on 2 different ways. One would be to go to the building fire, obviously along with the Boston Fire Department, but we just see the chronic health effects of, it's very well established, smoking and secondhand smoke, the chronic health effects. It's not unusual for our people. Boston EMS, we respond to over 120,000 incidents per year, so it's a busy service. We're responding in homes across the city on a daily basis, and it's not unusual to pull up, get a call for a child having an asthma attack, go into the house, and there will literally be someone smoking a cigarette inside the house while we're trying to care for the child, starting the oxygen. And so the secondhand smoke is a contributing factor, especially for children, and infants. It can lead to more frequent asthma attacks, worse asthma attacks when they do have it, ear infections, chronic coughs. For the, not children, for the older people, it can lead obviously to heart disease, other cancers. So it's just a chronic, almost totally preventable type of illness by getting the smoke out of the house. And what we're talking about here is not just the individual units, like a 3-family house where a single apartment may be smoke-free. We're talking about the entire unit and the balconies, the entranceways, so totally smoke-free.
Why go that far with it?
Well, it's funny, we're saying on the way in, we remember the old days where it used to go to a restaurant and you could pick whether you wanted to be in the smoking or non-smoking section, which you're in the same building. Or an airplane, a non-smoking section of an airplane. Is ludicrous to think back now, but it's really the same way with a house, that if you live on the 2nd floor and you have a non-smoking unit, but your 1st floor and your 3rd floor neighbors are smoking, maybe you're not getting as much secondhand smoke, but you're sure getting secondhand smoke every time you walk into that house.
Eugene, there have been some attempts already to put this into effect. There are some large property owners or management entities that have done it. Anything we know about how that has worked out so far? Yeah,
so we've been doing smoke-free housing at the Boston Public Health Commission for a long time, since 2008, and we helped Boston Housing Authority go smoke-free, which have about 27,000 residents, and we've helped hundreds of landlords and large property owners and go smoke-free. And so we, just this year alone, we transitioned about 8,500 units, mostly affordable housing. We know it's it's one of our focus because condo association, luxury condos, they're actually smoke-free. They use that as an amenity. So, but in affordable housing, we still have a long way to go, and our work is voluntary. We promote voluntary adoption of smoke-free housing. It's not a regulation, but it's been going well, and we have, like I said, we offer free training and technical assistance, and we have a website that with tons of information about smoke-free housing, and that people can go in. If then landlords want to transition, they can request training. They can also request no smoking leases. We have quitting resources for people who want to quit smoke. And we just launched a campaign in August citywide to promote the benefits of smoke-free housing. And we have billboards all over the place. And we hope more landlords are able to call us and actually work with us to transition their units to smoke-free, because like the superintendent said, it does benefit everyone, especially the children and elderly that spend most of the times indoors and inside the house.
We're talking with Eugene Barros from the Boston Public Health Commission and Brendan Kearney from Boston EMS. Superintendent, I guess another thing that occurred to me here is that if you make it more unusual or abnormal to smoke inside the home, and I guess that's the way of conditioning, the young people who are growing up. If they don't see it or they don't think it's a normal part of life, then maybe they're less likely to do it themselves.
Well, I hope so, and I think that's what the Public Health Commission and other health bureaus are all about. Educating the public of the dangers of any risky behavior. But in this case, we're talking about smoking, but just seeing how expensive it is, just not only to buy the cigarettes, but just the long-term health care costs. And by making it a little bit more inconvenient that, nobody's saying you can't smoke. It's still legal to smoke. People that live in these buildings can still smoke. But if by employers making it a little bit more difficult to smoke, landlords making it a little more difficult or inconvenient to smoke, maybe that would be the incentive for people to say, you know what, I probably should quit smoking. Standing out on the corner when you have to smoke a cigarette, where before you used to be able to smoke it at work, by making it a little bit more inconvenient, maybe that's the incentive some people need to quit.
Eugene, what about the help? You did say there was some help for people to quit. Quitting's not an easy thing, so how much help can you give them?
Not at all. And also, I just have to say, also caution people that smoke-free housing is not about preventing people from smoking. Like you said, it is people have to be ready to quit, but we do have resources available. Most Mass Health, if people are low income, there are a lot of people low income in this type of insurance. They have great benefits. All the private insurance do have quitting resources. So it's, they offer counseling and FDA approved drug therapy. So, we have help if people need it. But again, like you said, I just want to stress that smoke-free housing is legal. Landlord can actually, adopt this rule, and it's good for everybody. And also, it saves money, and like I said, it prevents fire. So,
of course, one other thing is that it's easier for a landlord to rent a unit that doesn't have that residual smoke odor. And it's better for a tenant because you don't want to move into something like that either.
So going back, what the superintendent has says, about 85% of Bostons don't smoke. So people actually want to smoke and want to live in a smoke-free building. So it benefits everybody, and it also in terms of it's less maintenance and less repair costs for the landlord. So it benefits everybody.
Finally, Eugene, you've got a website with some information that people can look at.
For more information, people can go to www.bostonsmokefreehomes.org to get more information and request training and get resources for smoke-free housing.
Thank you both very much. Eugene Barros from the Boston Public Health Commission and Brendan Kearney from Boston EMS.
Thanks, Chris.
In a moment, a prize-winning opera comes full cycle in Boston, but first, this message.